Hello, in this video, let us look at blastocyst. Blast O, blast O cyst. Okay, so what is this? And they are asking for 3 marks. So it is asked in anatomy, MBBS final exam, first year. What is blastocyst and why are they asking this in 2024 as latest as that? Because it is a very, very important topic in embryology. So this is coming under embryology. So let us look at what blastocyst is. See, normal, if there is fertilization, where does it happen? In the ampulla. So here you can see day one, once the zygote is formed, then it will have the first cleavage. In day 2, it will be called as blastomere. Blastomere, remember, it is mere here. It is not blastocyst. So don't get confused. If they ask blastocyst, it is still not here. You have to go further. This at this day 2 stage, what you have is blastomere. And then you have 2 still will become 4, obviously, right? 2 will divide means it will become 4. 4 will divide means it will become 8. 8 will divide means it will become 16. 16 is called as morula, I think. Okay. Morula. I'm trying to write that here. Morula. And then this morula will become blastocyst. Blastocyst. Okay. So what are they asking about in this examination? They're asking about blastocyst. Why are they asking about blastocyst? Now, did you understand that on day 5 to day 6, you have this blastocyst? Day 5 to day 6 of the fertilization. From the fertilization, they are counting. So you have the blastocyst. Now this blastocyst is the one that implants into the uterine wall, right? So you can see that this blastocyst will implant. Okay. So here in the last, they have shown you implantation of the blastocyst. That is why they are asking you to learn about blastocyst. Is it that much only? No. There is something more. In IVF, IVF is what? In vitro fertilization. In that, so what they do is they form this zygote. They have the zygote and they're going to implant it right into the uterus. Are they going to implant the zygote? No, they're not going to implant the zygote, not the cleavage, day 2, day 3, not the morula, not the, yes, the blastocyst. So the blastocyst is what they're going to implant. That is why this question is so important for us to understand. So they look under the microscope. When once it looks like this beautiful, like a blastocyst, they will implant it and then this will go in, they will transfer it, blastocyst transfer, and then that will go and implant in the uterine wall. That is why blastocyst they are asking in the exam. Okay, so even here at this stage they can implant. They are saying at the cleavage embryo stage, but that is not done because this one has better chances of survival. They will check its cell how it looks. Is it looking very nice? The shape, the size, everything, and then they will choose the best one and they'll put. So they don't have to put too many embryos. They'll put good ones, even one good one probably. So that is what it will reduce the multiple pregnancy risk. In exam, you will have to draw a blastocyst to get marks. Okay, so how will you draw it? So now look at blastocyst. Where is it? Here. This is blastocyst. Remember, you will draw this. This is what? Blastocyst. Okay, blastocyst. This is. Earlier, what did you see? Blastomere. That multiple small cells are there, no? Blastomeres. Then this is blastocyst. Blastocyst is a type of blastula. There is one word called blastula. And blastocyst is a type of blastula which is there in mammals, it seems. And this cavity here, they're calling it as blastocele or something. So many terms, okay. So this blastocyst itself has blastocele. Now, how will you draw this diagram? Remember, blastocyst has two separate cell structures. You have the trophoblast here around and inside you have the inner cell mass. This inner cell mass will become fetus and the trophoblast will become placenta. In the middle, what do you have? Fluid. What is that? In the blastocele. Okay, you have to draw this and remember there is no zona pellucida. That's what you have to write. This is blastocyst. Now this blastocyst, what its job is, guys? To go and implant. Very good. So it will enter this uterine cavity, uterine wall, that is endometrium. Can I say wall? No. The uterine lining, endometrium. Okay, it will enter. And as soon as it enters that uterine lining, they'll call it as decidua. So the terminology kind of changes. So decidua. Now wherever it enters, right, Yeah, wherever it entered, right, wherever it implanted, that portion they're calling as decidua basalis. Here you can see they have labeled decidua basalis, wherever it entered and implanted. Whatever is around the embryo, that is called as decidua capsularis, and remaining part of the uterus they're calling it as decidua parietalis. Did you understand, guys? Okay. Okay, this is only 3 marks and this and all is not important, but let me just tell you, this is decidua basalis where it implanted. Around the embryo, this will be decidua capsularis, and now around the uterus, remaining part of the uterus, whatever lining, that endometrium now will be called as what? Decidua parietalis. Yeah. So blastocyst is what? It comes under blastula only. Right. And after blastula, what comes? Gastrula will come. Okay. After that, a lot of other terminologies. So will you get 3 marks, guys? Remember to explain what it is. Remember to draw diagram. Remember to write its importance. Why they are asking all that now? Because of IVF. Okay. That will be your clinical importance. Okay. All this you write, you should get 3 marks. Okay. Bye-bye.